gluteal tendinopathies, lateral hip pain. It's usually quite easy to get on top of, and the patient, however, is usually quite worried, anxious, and somewhat disabled by it. So there's very quick ways that you can identify what the issue is. The first thing is to move the hip in a testing procedure to see whether the hip is mobile and identify where the pain is. So if the hip is mobile and still has a good range of motion, particularly up into flexion and some internal rotation, then it's most likely that it's not an arthritic hip.
So that's passive.
Yes, passive or active, but passive. The location of the pain, if they're getting the pain in the groin, it indicates it might be more jointy. But if the pain is on the lateral side, once again, it's very unlikely that that's osteoarthritic related pain. It's going to be the tendon. There's usually some things that they're doing which are aggravating the tendon, and they can be very subtle things, but not only are these important from experience, but they are specifically mentioned in the research as well. And one of them is standing and hanging on the hip, which is where you stand and take the weight through one leg, particularly mothers holding a child on one hip and taking all of the weight on that leg. It bows the hip and it puts passive strain down through the 𝗍𝑇B, and that in itself causes compression against the lateral hip and can irritate the tendons.